So this episode is going to be a little bit different, and there's a couple of questions that I actually want to get into and answer in this specific podcast episode. There's a product that's been talked about by many. Does this product, Minoxidil, work for beard growth? As I mentioned in this article, doctors noticed that patients experience quote-unquote abnormal hair growth, and so these patients would apply 0.5 milliliter of the formula or placebo on the chin or the jawline twice a day. And after collecting results, one of the things I want to address is it safe to use and ultimately therefore worth purchasing. And so whether it comes to skincare, whether it comes to working out and taking care of your health in that sense, I would definitely like to see where this podcast episode goes. And if there's some things that I'm definitely able to take from this, I think I would very much appreciate it. So hey, my name is James Charpentier, and welcome to Less Than 3%, where we talk about healthcare, my journey becoming a physician, and really anything from the perspective of a black male pursuing medicine. And in this episode, I want to get into something that was actually requested from somebody originally, but I never really got around to making the episode for it, and I think this would actually be a pretty good time to get into it. So this episode is going to be a little bit different. I think this is something that could definitely be enjoyable and probably even helpful to quite a few people. And in this episode, we're going to talk about something that's quite related to skincare. One of the more often talked about topics when it comes to maybe things related to skincare and hair, things like that, is actually beard growth. Specifically, there's a product that's been talked about by many when it comes to some of the many different things that people often use to try to enhance and promote beard growth and things like that. And the product that I'm actually specifically talking about is something known as Minoxidil. And there's a couple of questions that I actually want to get into and answer in this specific podcast episode. For instance, does this product, Minoxidil, work for beard growth? And is it safe to use and worth purchasing? And I actually think personally that I would definitely like to see where this podcast episode goes. And if there's some things that I'm definitely able to take from this, I think I would very much appreciate it. So let's get into it. So to first really answer, hey, does this work? I want to take a look at a blog that was written on forhims.com. It's titled Minoxidil for Beard Growth. Does it work? So the first question that they answer in this article, and really the first thing that I think I have to address in this episode, is what is Minoxidil? What exactly is it? How does it work? Minoxidil is an FDA-approved hair growth medication. It was first introduced in the 1970s, specifically actually as a medication for hypertension, which is the medical term for high blood pressure. So it had quite a bit of a different use back in the day. But as I mentioned in this article, doctors noticed that patients experience quote-unquote abnormal hair growth while using it. So as a result, there was a birth of a product known as Rogaine. So there was specifically a topical formula that was created in 1987, as I mentioned, and Minoxidil started being used as a topical hair growth formula. So this is something that can easily just be purchased over the counter to ultimately help, specifically in terms of hair growth. And it was approved by the FDA for the treatment of androgenic alopecia or male pattern baldness. So topical Minoxidil, it's applied twice daily. They mentioned in this article that it's believed by the medical community that it helps to improve blood flow to the scalp and allows it to really get the nutrients that it needs for that hair to grow. And to get a little bit deeper into the research, they mentioned that across multiple studies, that Minoxidil increases hair density better than placebos do. That shows that there's an impact there. And they found quite some results, specifically with a 5% concentration. So it's not hard to see why this product is in conversation when it comes to beard growth. And ultimately, what they mentioned is that there's not a ton of research on the use of Minoxidil, which is something I've kind of noticed a little bit. They do reference a study that was in a 2016 volume of the Journal of Dermatology as a quote. And in this research, what they did was they worked with the 3% Minoxidil formula over the course of 16 weeks. And so these patients would apply 0.5 milliliter of the formula or placebo on the chin or the jawline twice a day. And after collecting results, they found that photograph scores were significantly different for men who were using Minoxidil, as well as the average hair count. So off of some of this research, we seem to find that there are some impacts of Minoxidil. Now, with that being said, one of the things I want to address is it safe to use and ultimately, therefore, worth purchasing? And they mention a side effect of minoxidil, which is skin irritation. So there may be some itching that comes as a result of it, and those with allergies could potentially have a reaction as a result. They also mention as a tip, which I think is pretty important, that you can use a little bit of minoxidil as a patch test just to see if there could be an allergic reaction. Now, to go a little bit deeper in terms of the safety aspect of it, I want to take a look at one more article that was written by Alfredo Mineo, titled, "Can you use minoxidil for beard growth? We asked the experts." And I specifically want to look at the section where they talk about really who should potentially avoid minoxidil. And they mention in a quote that those with sensitive skin or conditions such as eczema or psoriasis should use caution. But this is really the only major side effect that I'm noticing here. So ultimately, when it comes to minoxidil, this really seems to be something that might not be too super heavily studied when it comes to its application for beard growth specifically, but it seems to be something that has some evidence behind it in terms of how it's able to work. In terms of its side effects, there really just seems to be the risk of skin irritation, a little bit of itching and things like that. And so in that sense, it can really be approached with caution. So ultimately, what I'm really concluding from this is it seems to have quite a bit of promise to it. And so if you're someone that's interested in a topic like this, you may want to take a look at a product like minoxidil. And I think another small point I can also throw in here is that this is really just an example of how there are a lot of aspects when it comes to care. I mean, for instance, we have dermatology as a specialty in medicine for a number of reasons. And so whether it comes to skincare, whether it comes to working out and taking care of your health in that sense, whether it comes to just your mental health and being able to participate in different activities that help you, it's definitely important that you're really looking at your health holistically and considering all the different aspects of your well-being and making sure that all those different things are in check. So I hope you enjoyed this episode. I hope you got some things from it, and let's see what we talk about in the next one.